Is bisoprolol safe during pregnancy? Have you ever wondered if taking bisoprolol during pregnancy is a safe choice? This is an important question, especially for expectant mothers managing hypertension. Let's break down the facts surrounding bisoprolol and its use during this special time. Bisoprolol is a beta blocker commonly prescribed to help manage high blood pressure. Controlling hypertension during pregnancy is essential, as untreated high blood pressure can lead to serious complications for both the mother and the baby. These complications may include stroke or adverse outcomes for the fetus. When it comes to bisoprolol, it can be used during pregnancy, but it requires careful monitoring. Pregnant women should have open discussions with their healthcare providers about the benefits and potential risks of taking this medication. One concern is that bisoprolol, like other beta blockers, may impact fetal growth. Therefore, additional ultrasound scans are often recommended to keep an eye on the baby's development. Interestingly, bisoprolol is a beta-1 selective blocker, which means it tends to have fewer adverse effects compared to some other beta blockers. However, labetalol is usually the preferred choice for managing hypertension during pregnancy due to its more extensive safety data. Research indicates that using beta blockers during the first trimester does not increase the risk of congenital malformations. However, there is a possibility that these medications could lead to intrauterine fetal growth restriction. This is why monitoring fetal growth is so important while taking bisoprolol. The decision to use bisoprolol during pregnancy revolves around balancing the risks of uncontrolled hypertension against the potential effects of the medication. Since high blood pressure itself can pose risks to both the mother and the baby, managing it effectively is a top priority. For those considering breastfeeding while on bisoprolol, it is generally seen as acceptable if the baby is healthy. However, it is worth noting that bisoprolol may pass into breast milk in slightly higher amounts compared to other beta blockers. Consulting with a healthcare provider before breastfeeding is a wise step. In summary, bisoprolol can be used during pregnancy for managing hypertension, but it requires close medical supervision. Monitoring fetal growth is essential to ensure the safety of both mother and baby. While it may not be the first choice among beta blockers for pregnancy, it can be appropriate in certain cases where the benefits outweigh the risks. The main goal remains effective control of maternal hypertension to minimize complications.